This is Dr. George Morris, and this is the President's Newsletter for August 2010. I'm very fortunate today to have with me Dr. Bevan Baker, who is our Milwaukee Commissioner of Health. Dr. Baker is also on our board of directors of the Medical Society of Milwaukee County and is a wonderful contributor to our board's activities. Today we're here to talk about one more part of keeping Milwaukee and its community healthy. He has initiated a very interesting campaign about sleeping safety, and I've told him that I'd like him to tell us a little bit about that campaign. Dr. Baker?
Thank you for having this session so that we can talk about what's a very important issue, which is infant mortality reduction in our community. And as you well know, and many others, Milwaukee has a high rate of infant mortality in certain zip codes and certain cohorts, and one of the things that we want to do in the healthcare and public health community is to reduce those rates. Many of the deaths that we see among infants are preventable, if not all, and the ones that are most troubling are those that are due to unsafe sleep positions. They can be 100% avoided, and we need to do more about that.
Well, so what is this program that you've started doing?
Well, one of the things we wanted to do was to educate, and we have been educating for many years along with providers and physicians all across our city, but it doesn't seem to have taken hold. So we've been a little bit more provocative with some of our campaigns to get the attention of the people we're trying to reach, to say we need to stop this tradition of babies dying before their first year of life because of unsafe sleep positions. So we've used some cutting-edge, somewhat over-the-edge campaigns to get the attention of consumers and then educate them about sleeping safely with their babies.
You've kind of mattressed this campaign.
Well, I think that's putting it in a very literal sense. You know, one of those things that people assume that if you put the baby on a mattress, an adult mattress with you, that and you're there, it's safe. But really, that's not the best place for a baby. And what we wanted to show in one of our campaigns with our media partners is that many babies, that's their last resting place. They die there in an adult bed. The best place for a baby is to place it on its back in its own crib, and then that baby will be alive, hopefully in the morning, and not from a rollover or asphyxiation or some sort.
Well, you made it sound like this might be controversial in some way. Is there anything controversial about sleeping safety?
Well, there are many around the nation, and some here in Milwaukee, who made their research and their life about the way to sleep safely with your baby. And many people do it, and thousands of times a day and week and year all over the world, people sleep with their babies and they don't have negative outcomes. But that one time that does happen, it is a tragedy that it could be avoidable. So what we say is that why take the chance? Mm-hmm. A life is such a precious thing, and a baby is one of those things that one shouldn't take the chance with. Put the baby in the crib, and our goal is to educate people and then also to help link those who may not be able to get a crib to a crib. Right.
The Cribs for Kids program being one of them that the society at one point supported with grant underwriting. How do you see, how are you going to measure the success of this program?
Well, first I want to make it clear that this is not going to happen overnight. We have a tradition of people sleeping or co-sleeping with their babies. We've had at least 10 deaths so far this year. So to change this overnight will be difficult. We do want to start a tradition of people sleeping safely with their babies. So as we see the numbers go down, unfortunately we have to use the number of babies that die. We have to use a coroner's report as whether or not we're having a good outcome. I'd rather not have that, but I think if we look just like they did with car seat safety and see how people started strapping their infant in, it's almost unimaginable now that someone would put a baby in a car and not strap them in. But 40 years ago, people didn't do that. So we may be looking at multi-years to educate the public, but we are starting somewhere, and we're starting in a provocative fashion.
Well, I have to say I really enjoyed the campaign. I actually diverted myself and drove down Capitol just to see these. And in fact, we had hoped to have this interview in front of one of those mattresses, but the intervening flood of Milwaukee kind of took its toll on this process. Well, thank you.
No,
Thank you very much for this
Thank you,
opportunity to hear about the program.
And thank you for alerting all of the providers in our physician community through the medical society that this is important. We can't do it alone. We do need the help of physicians and clinicians to educate the public.
Well, we'll keep that up. This is Dr. Morris, once again inviting you to share with your patients about sleeping safety and the issues that it engages. Thank you.